Hey everyone, and welcome back for another deep dive. This time, we're going to be tackling a pretty important topic, the
Okay.
connection between mental health, pregnancy, and multiple sclerosis.
Right.
And, we've been looking at some really interesting research about a study
Mm-hmm.
that looked at the risk of mental health challenges during and after pregnancy for people with MS.
Yes.
And some of these stats are pretty surprising.
Yeah, they are pretty eye-opening for sure.
So maybe before we get into all the details of the study itself,
Oh,
could
go
you
ahead.
give us like a super quick refresher on what MS is and how it can affect the body?
Yeah, absolutely. So multiple sclerosis, or MS, is a chronic autoimmune disease
Okay.
where the body's own immune system basically attacks the protective covering of the nerve fibers in the central nervous system.
Oh, wow.
It's kind of like if you imagine like the wiring in your house getting frayed,
Right?
and that causes like a disruption in communication, and that can lead to a whole bunch of different symptoms.
Right.
Fatigue, muscle weakness, vision problems, even difficulty thinking clearly.
Wow. So that analogy really like paints a picture of how challenging it can be to live with MS,
Yeah.
even without like the added challenges of pregnancy and new motherhood.
Right.
So tell me about the study. What made it stand out to you?
Well, first off, just the size of it was pretty impressive.
Okay.
Over 890,000 pregnant individuals were involved, which is huge.
Wow. Yeah.
One of the largest studies of its kind.
Okay.
And the researchers were able to compare pregnant people with MS to those with other conditions too, like epilepsy and diabetes,
Uh-huh.
and also to a control group without those conditions.
Gotcha.
So having this like broad perspective really strengthens the findings.
Okay, so let's dive into those findings then.
Sure.
What did the study reveal about the mental health risks for people with MS during pregnancy and postpartum?
So the study found that 42% of pregnant individuals with MS experienced mental health challenges like depression and anxiety during pregnancy. And then that number jumps to a pretty concerning 50% in the first year after giving birth.
Wow.
And to put that into perspective,
Yeah.
only 30% of pregnant individuals without MS experience mental health challenges during pregnancy,
Right.
and 38% in the postpartum year.
Wow. Those are pretty significant differences.
Yeah.
Were there any specific mental health conditions that seemed particularly common in the MS group?
Yes, so the study actually found an increased risk across a range of conditions.
Okay.
Anxiety, depression, bipolar disorder, and even psychosis.
Wow.
And what's important to note here is that a lot of these were actually new diagnoses.
Oh, wow.
It wasn't just pre-existing conditions flaring up.
Right.
So it points to a real vulnerability during this time.
Right.
The only exception, though, was suicide attempts. That didn't show a significant increase.
Okay, that's maybe a little bit of a reassuring point amidst all this other concerning stuff.
Yeah.
But one other number that really stuck out to me was
Wow.
the increase in substance use among people with MS after childbirth, going from just 0.54% during pregnancy to 6% afterwards.
Yeah, you're right. That is a huge jump.
That's a really big jump.
Yeah, and it highlights just how complex this issue is.
Right.
There's clearly a lot going on physically and emotionally
Yeah,
for people with MS who are trying to navigate pregnancy and new parenthood.
for sure.
So the question becomes, why?
Yeah.
What factors might be contributing to this?
Yeah, I mean, it seems like there could be so many different things at play. Biological, psychological, social factors.
Totally.
For example, I know that like hormone levels go through these major shifts during pregnancy and postpartum.
Yes,
Could that be a contributing factor?
absolutely. Hormonal fluctuations can have a really big impact on mood and emotional well-being.
Right.
Plus, in some cases, MS itself can actually affect hormone regulation, which can complicate things further.
Wow. Okay.
And, it's not just about the hormones themselves.
Right.
These fluctuations also trigger changes in the immune system, which obviously plays a key role in MS.
Okay. So can you break that down a little bit more
Sure.
for our listener? How exactly might these immune changes during pregnancy influence MS and mental health?
Okay, so during pregnancy, the immune system basically has to adjust to prevent the mother's body from rejecting the fetus.
Right.
And this involves a shift in the balance of certain immune cells.
Okay.
And while it's totally necessary for a healthy pregnancy,
Yeah, of course.
it can also impact MS activity.
Oh, wow.
And we know that inflammation is a big part of MS.
Mm-hmm.
And it's also been linked to mental health conditions like depression.
Right.
So it's possible that these immune shifts could actually be contributing to this increased risk of mental health challenges that we see.
Oh, that's fascinating. Like this whole mind-body connection is so crazy.
Totally.
And of course, we can't overlook the stress that comes with pregnancy and new parenthood,
Oh, yeah, for sure.
especially when you're also managing a chronic condition like MS.
Absolutely. The physical demands, the potential complications, the lack of sleep, the emotional roller coaster, it can be completely overwhelming for anyone.
I can only imagine.
But for someone who's also dealing with the uncertainties of MS, the fatigue, the mobility challenges, and even the potential impact on their treatment plan,
Right.
the stress can just get magnified so much.
So it sounds like we have this perfect storm brewing.
Yeah.
You've got the hormonal fluctuations, the immune system shifts, and these increased stress levels
Right.
all happening at the same time as all these other major life changes and adjustments.
Exactly.
So it's really no wonder that mental health can take a hit.
Yeah, and the study authors actually specifically pointed out that even after they adjusted for other factors,
Okay.
like age, income, and even pre-existing mental health conditions, people with MS still had a way higher risk of developing mental health challenges during and after pregnancy.
Wow.
It really emphasizes the unique vulnerability of this population.
Right. And this is why this research is so important.
Absolutely.
So we've laid out the problem, the why behind it. So I think in the next part, we should dive into solutions.
Yeah, sounds good.
What can be done to better support those with MS during this really crucial time?
Let's do it.
Knowing these risks, what can we actually do to support these people, individuals with MS during this time? Like, what are some practical steps?
Well, I think a big part of it is just open and honest conversations.
Okay.
Healthcare providers really need to be proactively talking to their patients with MS about mental health.
Okay.
Ideally, even before they get pregnant and then continuing throughout the pregnancy and well into the postpartum period.
So it's more than just like a quick check-in during a regular appointment?
Yeah, exactly. It's about creating a space where those patients feel comfortable,
Yeah.
talking about their emotional well-being and any anxieties they might have, any changes in their mood or energy levels.
For sure.
I think it's also about providing education and resources to those people,
Okay.
helping them understand, the potential risks and giving them some tools to cope.
So what kind of resources would be like the most helpful in this situation? I imagine like just general pregnancy resources
Right.
might not fully address the specific needs of someone with MS.
Yeah, definitely. And that's where, targeted resources become so valuable.
Okay.
Like support groups specifically for people with MS who are pregnant or postpartum.
Right.
Those can be amazing because it gives them a safe space to connect with others
Yeah.
who really get it,
Yeah.
who understand the unique challenges.
Yeah.
And they can share experiences, learn from each other's coping strategies.
That peer support can be so powerful.
Yeah, for sure.
Are there like other ways to connect with people who are going through similar experiences?
Totally. Online forums and communities can be awesome.
Yeah.
Especially for people who might not be able to get to in-person groups.
Right.
Or if they just prefer to be anonymous online.
Right.
There are also some great organizations like the National Multiple Sclerosis Society
Okay.
that offer a ton of info and support.
That's good to know, but I think sometimes even with support groups and online communities, it can be hard to manage those really intense feelings. So is therapy something that you would recommend for individuals with MS during this time?
I think therapy can be incredibly beneficial.
Okay.
I would definitely recommend it.
Okay.
Cognitive behavioral therapy, or CBT, has been shown to be really effective for things like anxiety and depression.
Yeah, I've heard of CBT before, but can you just quickly explain how it works?
Sure.
For a listener who might not be familiar with that type of therapy, what does it actually involve?
Basically, CBT focuses on identifying and changing negative thought patterns and behaviors
Okay.
that are contributing to those feelings of anxiety or depression.
Right.
It's really practical and skills-based.
Okay.
It teaches people really concrete techniques to manage their emotions and cope with tough situations.
So it gives people tools that they can use even after therapy's over.
Exactly.
Yeah. That's great.
Mm.
But I think sometimes, even with therapy and all this support, the symptoms can be really severe.
Yeah.
So what role does medication play in all of this?
Oh, that's a really important question.
Yeah.
And I think one that really needs to be discussed carefully with a healthcare provider.
Right.
While some medications are considered safe to take during pregnancy and breastfeeding, others might not be.
Right.
So it's all about weighing the potential benefits against any risks
Right.
and finding what's right for each individual person.
It's so individual.
It really is. And I think it's also important to remember that, Mental health is just as important as physical health.
Of course.
And there should be absolutely no shame or stigma attached to seeking professional help or taking medication if you need it.
Absolutely. I think we can all agree with that.
Yeah.
It sounds like, in all of this, family and friends also have a big role to play.
Oh, for sure.
In supporting someone with MS during this time. But I imagine it can be kind of tough for loved ones to know, like, how to be actually helpful.
It can be. Yeah. What advice would you give them?
Yeah, like what can they actually do?
I think, honestly, sometimes the most powerful thing you can offer is just your presence.
Oh.
Just being understanding, supportive, and not judging them.
Yeah.
Those things go a long way. And,
Yeah.
offer a listening ear, let them cry on your shoulder,
Mm-hmm.
help out with errands and stuff if you can.
Right.
Those little acts of kindness can seriously make a world of difference.
Those are such good reminders. It's not about like trying to fix them or give
more.
advice that they didn't ask for.
Please just be there.
Just show up for them. And alongside all that external support, I imagine self-care is really important too, right?
Oh, absolutely.
Especially during a time when it's so easy to like put your own needs on the back burner.
So easy.
Yeah.
Yeah. You're right. It's crucial for people with MS to prioritize their own well-being.
Right.
Even with everything else going on, get enough rest, eat healthy foods.
Yeah.
Do some gentle exercise if you can, and find healthy ways to deal with stress.
Yeah.
Like meditation or being in nature.
I love that you mentioned those stress-reducing activities.
Yeah.
It's like so easy to forget about all that when you're in that whirlwind of new parenthood.
Totally. And that's why it's helpful to have reminders.
Yeah.
And even better to build those practices into your routine before the baby even gets there.
Right.
So that way, when things get crazy, and they will, you already have those tools.
We're prepared.
Yeah.
Yeah, sounds like we've covered a lot of potential solutions and support systems.
Yeah, we have.
But if we're being totally honest here, it feels like there's still a lot of work to be done.
Oh, yeah.
In terms of raising awareness.
For sure.
And improving access to these resources.
Yeah, you're absolutely right. We need more research to fully understand this whole complex connection between MS, pregnancy, and mental health.
Yeah.
We need to train healthcare providers to better address these issues. And we need to push for policies that support mental well-being for people with MS during this vulnerable time.
Yeah, it's a huge challenge.
It is. It's a multifaceted challenge that needs a multifaceted approach.
We've definitely talked a lot about the challenges.
We have.
But I think there's hope here too, right?
Oh, definitely.
What are some potential solutions you see kind of emerging on the horizon?
Oh, that's a great question.
Yeah.
And a good one to think about as we move into our final part here.
Okay.
There are so many possibilities, from shifting how we think about these things as a society to creating more inclusive and supportive environments.
Yeah.
It's about, making a world where people with MS feel empowered to get the care that they need and deserve.
Absolutely. We've talked about the challenges and some potential solutions, but let's get a little more specific.
Okay.
What can individuals with MS actually do, to advocate for themselves and their mental well-being during pregnancy and postpartum?
Well, I think, being your own advocate is so important.
Yeah.
Don't be afraid to speak up about what you need and what you're concerned about to your doctors, your family, and your friends.
Right.
I know it can be tough to ask for help.
It can be, yeah.
But just remember that you deserve support.
That's a good point. Voicing your needs can be hard.
Yeah.
But it's the first step to getting the right support.
It is, yeah.
So how can communities contribute to creating a more supportive environment?
Oh, totally. Communities can make a huge difference.
Yeah.
In reducing stigma and making people feel like they belong.
Okay.
Support groups are awesome, both in person and online.
Yeah.
But it doesn't have to be, official groups.
Right.
Friends, neighbors, colleagues.
Yeah.
Even just a simple, how are you really doing?
Right.
Or an offer to help out with errands can go a long way.
I think those little gestures of support can really mean the world.
They can.
When you're feeling overwhelmed. So now, kind of shifting gears a little bit to healthcare systems.
Okay.
What changes do you think could make a real impact in supporting individuals with MS?
I think healthcare providers really need to be better equipped to address the mental health needs of their patients with MS.
Right.
Especially during pregnancy and postpartum.
Okay.
And that means, more training on the unique challenges this group faces.
Right.
And, incorporating routine mental health screenings into prenatal and postpartum care.
It sounds like we need to move beyond just asking, how are you?
Totally.
And really dig a little deeper.
Exactly. And of course, ensuring access to mental health specialists is critical. But it's not just about like referring people out to specialists.
Okay.
It's about actually integrating mental health care into the overall care plan.
Right. So a more like holistic approach.
Exactly.
I like that.
Yeah. And we also need to advocate for policies that actually prioritize mental health care and provide resources for these individuals and their families.
So it's like a multi-pronged effort.
It is.
Raising awareness, improving education, and pushing for systemic change.
That's right. It's not a one-time fix.
Right.
It's an ongoing journey.
Yeah.
To create a more inclusive and supportive society for everyone, no matter what health challenges they're facing.
This research, while it's concerning, it's also like an opportunity.
It is.
Yeah.
By shining a light on this issue. You know, the increased mental health risks that people with MS face during this time.
Yeah.
We can actually create change.
We can break down stigma, improve access to care, and ultimately just support the well-being of these individuals and their families.
Absolutely.
And I think it's important to remember that even small actions can make a difference.
It can.
Like a listening ear, a helping hand, or just a kind word can go a long way.
They really can.
In creating a more supportive and empowering environment.
For sure.
Well, thank you so much for joining us on this deep dive exploring the intersection of mental health, pregnancy, and multiple sclerosis.
It was my pleasure.
We hope this episode has kind of sparked some new awareness and inspired you to advocate for yourself, your loved ones, and your community.
Absolutely.
Until next time, stay curious and keep diving deep.
Thanks for having me.